Hi everyone. If you're new here, my name is Asia. I'm a nurse, I'm a researcher, and I'm a blogger. And I've recently started making YouTube videos about nursing school, things I wish I knew before nursing school, all things related to nursing and graduate school, because those are the things that I care about. So if that's something you're interested in, you should definitely stick around. So today I wanted to talk about what nursing school does not teach you and things I wish I knew while I was in nursing school or before I started. So I'll cover 5 main things. The first being stress management and self-care, and like work-life balance related things. There's basic money management. There's documentation burden from working in the hospital, like charting and stuff. Then there's professionalism and effective communication in the workplace, and balancing the struggle of work as done versus work as imagined. So I will now go into a little bit of dialogue about each of these 5 things, as well as some strategies that may be helpful that have helped me learn from my personal lived experience. So, self care and stress management. I do not believe that my nursing program taught me much about managing the stress that comes with being a nurse. Um, there's a lot of burden associated with working 12-hour shifts. There's a lot of burden also associated with being a brand new nurse, fresh out of your uh, nursing program, and so I think that for at least for me and the school I went to, there really wasn't any discussion about managing burnout or acknowledging burnout as a problem that nurses have. And I think that that is so unfortunate because so many nurses, especially new nurses, experience burnout in their first job. I think the statistics say that like a very large percentage of new graduate nurses will actually leave their first nursing position within the first 2 years. And so a lot of that is driven by burnout and a lack of work-life balance. And so I think that there is a need for pre-licensure education to kind of have that woven into the curriculum, because it's definitely something that impacts a lot of nurses, most nurses, I would say. Some strategies that have personally helped me with self-care since I've been a nurse is prioritizing sleep. Sleep is so important in terms of being able to deal with the emotional component of working in the hospital, being able to keep your cool in stressful situations, as well as being able to maintain cool in the workplace, because sometimes you're dealing with chaos from your work environment, not just the clinical component of the environment. It's also super duper important to eat nutritious foods. I remember when I first started working in the hospital, I realized very early on that if I ate a very carb dense lunch, it was really hard for me to keep my energy up to get through the rest of the day. So my recommendation is to really find foods that fuel your body, not drain you. I know we live in a culture of DoorDash and Uber Eats, but a lot of that restaurant food is not ideal, definitely while you're working a shift. You definitely want to eat something nutritious and nutrient dense while you're working, and definitely just in general, in terms of your lifestyle, adopting a healthy diet is just important overall. So let's see what else. Exercise is so important for stress management. I have personally probably lost about like 35-40 pounds since I first became a nurse, and exercise is really one of the main drivers in, I think, me having overall good mental health. I think that there is a tremendous association between um, managing work stress and exercising. And if you can find ways that help you feel good about yourself and your life, such as exercise or something else, definitely embark on that, because it's super important to take care of your body, to move your body, and to rehabilitate your body from being on your feet all day and working in the hospital. Also, I'll talk a little bit about stress management. So if you've seen my previous video about my research trajectory, you'll know that all of the research I did for my doctoral dissertation um, was about well-being in the context of nurse leaders and administrators. And in the process of completing my dissertation, I actually became certified to teach a resilience course. And some of the things that we learned in that resilience course is how to identify from a physiological standpoint when we're experiencing stress, so that we can incorporate some wellness skills and some mindfulness techniques to stop that stress response. And so there's, you could look this up, but there are a couple of different wellness skills that we teach, and it really helps to combat stress in the moment. And that's so important because it's so easy to get thrown out of your comfort zone, or your zone of okayness at the hospital. And if you can find strategies to incorporate when you notice that you're outside of your okay zone, you heighten the odds that you have better control over your emotions. And so some of the techniques include like counting backwards from 5, or taking a cool sip of water and feeling the sensation as it goes down. You can do grounding techniques and like physically plant your hands on the ground or lay your back up against the wall just to get regrounded like to gravity. There are a lot of different techniques that you can incorporate in the moment if you're experiencing stress, and these techniques have been very transformative for me in my life, both as a nurse and just as a regular person, like in traffic, navigating grocery store lines, just keeping my stress under control. Okay. Also, in terms of work-life balance, it's so important to have hobbies. I think that the older we get, the less we realize how important play is, but play is super important. So I think it's worthwhile to either explore new hobbies or tap into old hobbies that you used to enjoy when you were a lot younger. And so for me, that has really looked like making exercise and fitness a hobby. I've started doing indoor cycling classes in addition to like hot yoga and hot Pilates, all of these different types of exercise as a hobby. So if that is, if there are hobbies that you've had in the past, try to pick them up. It really may be advantageous to you. Okay, so next we have basic money management. I do not think this is worth a tremendous amount of time, but I will say that nursing was the first job that I ever had that offered a decent salary, like a real, consistent, adequate bill paying income. Prior to me being a nurse, I worked for tips, I worked in restaurants, I worked as a waitress. And so because I was so accustomed to having dollar bills everywhere, having a nursing salary with a direct deposit, consistent income, this was the first time that I ever had that. And so nurses make a decent income. And I think that when people are making an adequate income, it's important that their money is organized and that their money is being used to support their long-term goals. And so once again, nursing school doesn't talk about this, but this is something that I think is important for nurses to know before they become nurses, is that you need to identify what your long-term financial goals are so that you're working towards something. Otherwise, you're just going to work and getting by. So some of the recommendations I have that have been tremendously helpful for me is I save 10% of everything that I draw in terms of my income, and saving 10% of my income has helped me not only save consistently, but also it made me realize that the 90% that I was living off of, I really wasn't missing the 10%. And so I think it's really important to recognize how you can save consistently. It's not necessarily important that you save a lot, but it is important that you save. And so this is not a financial advice video, but it is important that you save because things come up. And just because you can go to work doesn't mean that the solution to every crisis is to pick up another shift. You should be financially prepared for the things that life may throw at you, because you do have a decent income as a nurse. Let's see. Also, I kind of wanted to talk a little bit about life insurance. So the first life insurance policy that I ever had was through my nursing job. It's important also to understand that when you leave a job, you also lose the life insurance policy that was associated with that job. So my recommendation is to always have your own life insurance policy independent of your job, so that it doesn't matter where you work, but you always know that you have a policy. Life insurance is important. That's not what this video is about, but definitely do your research on life insurance. And finally, financial advising. I recently got a financial advisor. I shared with my financial advisor I recently shared with my financial advisor like my goals and objectives in terms of when I want to retire, my plans on debt mitigation, my plans on investment, as well as my plans for contribution. I went through all of my financial objectives with my advisor, and I have a plan of how to execute those goals in a certain amount of time. And so I think that it's important to have financial advising, just because like we went to school to be nurses. These people went to school to help people organize and manage their finances, and that's not what your expertise is as a nurse. And so it's helpful to have someone help you with your wealth management. Okay, that's all. That's enough about money. We'll go to documentation is a burden. So charting in the hospital is probably the most time consuming thing that you will do in addition to patient care. And the school that I went to didn't offer a lot of opportunity to talk about documentation or the time management needed to document while you're a nurse in the hospital. And so one of the things I'll say is that when I first became a nurse, charting was like the worst part of my shift. I literally was always at work late to 9, 10 o'clock charting, even if I had to be back at work the next day. And I have strategies now that I've recognized in practice that have helped me tremendously with getting my charting done. And so that's just something that we didn't learn in nursing school that I now have strategies for that I want to share with you all. So just recognize, for anyone that's not familiar, charting actually takes more time for nurses and doctors than patient care. And charting is important because documentation is how hospitals are reimbursed for the services they provide. It's how we are able to ensure that the care that we're claiming to give is being provided. And documentation is essentially the only way to know that you provided the care that you provided. And so, you know, that quote is like, if you didn't document it, then it didn't happen. And so documentation is super duper important. And with that being said, it's important to recognize that you want to be accurate and thorough in your documentation. And so one of the things that I've started doing now as a more seasoned nurse is documenting as I go. It is actually so much easier and so less cognitively burdensome to document while I'm in a patient's room. And I will say that, you know, that's not always possible. Sometimes things come up that interfere with what you're doing, so you're not able to spend the extra 8 minutes in the room charting an assessment in real time. But charting in real time has ultimately changed the way that I provide patient care. I feel much more thorough in my assessment because I'm documenting it as I go, versus doing 5 assessments and having to go remember what I chart or what I found on who. Additionally, there is a need to review your documentation. If your unit or your hospital requires that certain things are documented, just ensuring that you actually have documented it. I have not documented on super important things and have literally had to turn around and come back to work to document. So it's just really important that you know the documentation protocols at your job and that you're abiding by those protocols. but also that you're finding ways to manage your time as a nurse so that you can actually be an attentive nurse and not just a nurse that's staring at a computer screen. Next, we're going to talk about professionalism, conflict resolution, and communicating effectively in the workplace. So, professionalism is a lot of different things. Professionalism is coming to work and ensuring that you look neat and tidy, like you belong there. Professionalism could also mean that you your clothes are clean and fresh. We're not smelling like cigarettes or outside junk. When you're at work, you should be clean, you should be appropriate, you should be ready to work, first and foremost. Second, communication and conflict resolution. One of the things that I will say about communication in the workplace is that it's always advantageous for you to hear people out. A lot of times, patients do not feel heard, and a lot of times, because patients do not feel heard, it manifests as frustration or a lack of satisfaction with the care that's being provided. Just because, the nurse that you get report from says that a patient was cranky doesn't mean that that will be your experience if you listen to that patient and hear them out. Additionally, it's important that you listen when you are communicating with your staff, with your coworkers. I'll say that I have given report to people who were on their phones. I've given report to people that were staring at the computer screen, not writing down one thing that I was saying. And I believe that in terms of appropriate handoff, it's so important that we are not only listening, that we're not only sharing important information with our colleagues, but also that we're listening to the important information being shared with us. So that's communication in the workplace. I think another thing too that we can bring up in terms of professionalism and communication in the workplace is dealing with conflict and having to deal with leaders. Leadership has a lot on their plate typically in terms of handling clinical tasks and operations, as well as administrative tasks and operations. And leaders are very overwhelmed with the sheer amount of work that they have to do. So if you are having to approach your manager or charge nurse about an issue, make sure that you're coming to them with a solution-oriented mindset. It's really not helpful to you or the leader that you're approaching about a conflict for you to be in your feelings or turned up or all of those things. None of that is really advantageous. You really want to be emotionally intelligent at work as possible because it's already a chaotic and stressful environment. Nobody can get better if the people there providing the care are acting a fool as well. Also, this is just a disclaimer, nursing is a predominantly female profession, and I don't know if that's why gossip is so common in nursing, but do not gossip at the workplace. Gossip not only means speaking ill of people who aren't present or who are present, but even speaking about anybody at all is not necessary. There's no need in getting into dialogue about other people at work if it's not supporting the delivery of high quality and efficient patient care. So just keep that in mind that anything you share with a colleague is not safe information. We should not be gossiping about our staff members at work. We shouldn't be gossiping about our managers at work. And we definitely should not be gossiping about patients and patient family at work. And these things happen every single day in the hospital. And so I just think it's important to understand that although that culture can happen, you don't want to participate in it. And by you failing to participate in it, you help heighten the odds that some of that culture will die down. And lastly, I wanted to talk about work as done versus work as imagined. So this is kind of like a human factors engineering term, and it really just means that the way that the policies are designed and the way that the job is designed typically is based on work being completed as it's imagined. But in real life, oftentimes we have to make workarounds, or we have to come up with creative, innovative solutions to do things, because work as done is a lot different than work as imagined. And so in nursing, sometimes that looks like overriding medicines in the machine. Sometimes that looks like, let's see, or overriding a scan because the computer won't scan. Um, Sometimes workarounds might look like, having to take another patient because someone got sick and had to go home. So a lot of times the policies and the practices of the unit are established based on an ideal situation, but oftentimes work is not ideal. And it's important to understand that work not being ideal can interfere with the quality of the care that you provide and how good of a nurse you can be. I always tell people that the quality of your nursing care will rise or fall to the quality of the employer and that employer's ability to um, create an environment that supports high quality care. And if you work for an employer that does that, you will feel adequate and competent in your role. In the event that you work for an employer that does not prioritize, certain aspects of work, you will feel like your job performance is poor. And it's important to understand that work as done versus work as imagined is essentially just a concept that we all have to balance. And you want to make sure that you can do the most ethical thing possible with the resources that you have. And yeah, so I think that's about all I had for what I wish I learned before nursing school. And if you like this video, share it with somebody that you care about.